Good morning. How is everybody today? It is February 9th, 2026. It is also my daughter's birthday today, so happy birthday. And yeah, just froze my butt off doing that little dance video with Dawson. It is minus 30 out there in Ottawa. Crazy burr temperatures. And I guess we're getting some more snow tomorrow. So, and I mean, you can see in that video how much snow we already have. It's a lot. And it's freezing out there. So hopefully all the homeless are, are able to find a warm place to stay. And yeah, I just wanted to talk a little bit about the Grammys and Ozempic. Kelly Osbourne was at the Grammys, and just kind of breaks my heart to see her like that. I wouldn't have even recognized her. This drug came onto my awareness during the presidential election at the very beginning when RFK was running for president, and he came out with this whole thing. Tucker Carlson did a whole thing on Ozempic and how terrible it was for you. And I could list off a couple of the things that happens when you use this drug. But I suggest that you really do your own research if you're thinking about using this drug. I know someone who's lost somebody due to Ozempic, like legit. They're not here anymore. So I know it's a very dangerous drug. And RFK just did a whole flip when he was doing his presidential campaign. It was a whole big thing on how terrible this drug was and that it's killing people. And then fast forward to last year, 2025. And he's with President Trump talking about how they're going to make it less expensive for all the obese poor people that can't afford their shots of Ozempic. And Ozempic is a drug really that was at first produced for people who are diabetic, and they figured that had this wonderful side effect of weight loss. So now, all these people who are overweight are using this drug to lose weight. And you really see it right there played out in front of you on the big screen when you see people like Kelly Osbourne, and Ryan Seacrest was another one at the Grammys who my heart just kind of, back in the 90s, Ryan Seacrest was a big deal. And to see him like this, like what the hell happened, and why do they not see it when it is so blatantly obvious for the rest of the world to see it? So anyways, pay attention. And any of these drugs that they're trying to sell you for lifelong basis, antidepressants for starters, hormonal therapy for another, antidepressants, now with puberty blockers and stuff we could go down a whole nother rabbit hole with that one, but I want to stick to this right now. And Ozempic is one of those drugs that is marketed to you that you really have to be on for the rest of your life. You don't get to walk away. Methadone is another one of those drugs that they like to tell you that you need for the rest of your life. And I've known people who have tried to get off methadone, but the doctors don't want you to do that because they get paid per patient. And so it's very difficult for people to get off that drug. Anyways, that again is another rabbit hole. And didn't want to really go down there. Now, I did not see the Super Bowl yesterday. Didn't watch the halftime. I'll probably have to go back and see some stuff on that. yeah, just really important to just really research anything that they're trying. I mean, the problem is with people like myself now, we're afraid to go to the doctors for anything. I mean, I would rather, suck it up or try to meditate on stuff if I feel even the slightest bit of yuck coming on. And it's just crazy how sad that is. We just recently had a woman, I believe she was in Saskatchewan. I'm not entirely sure, so maybe I should just shut up. But somebody here in Canada died while waiting in the waiting room. This is happening much more frequently. Another thing that I should talk about at some point is the MAID program here in Canada, because I'm sure people are really shocked to learn what's going on. I mean, my feed versus somebody's feed who isn't awake is entirely different, right? The stuff that I get put into my awareness is totally different. And it's just really sad that Canadians are feeling so depressed that they're turning to a solution. And I mean, I talked about this a little bit with my girlfriend the other day, because I was shocked. Like, the drugs they use to euthanize you are not very empathetic at all. It looks like a very peaceful death, but it is not. And I wondered, why don't they just use fentanyl? Like, I've seen so many people, even right on the high street, that are dying using that drug. But I guess they can't harvest your organs if you're using those drugs. So they need to use appropriate drugs to be able to harvest your organs. Yep. Canada, eh? Yeah, I love this country. I love my people. I hate my government. And I look forward to change. And I really hope that this digital ID never happens. And I like my cash. I like my cash. I like nobody having to know what I spend my money on, because as you can see, I'm a little bit, Anyways, I hope you all have a fabulous Monday and enjoy your week. And sorry this video was a little bit dark, but it's important that people are aware of the medical system here in Canada. And as far as the Ozempic is concerned, that's definitely Canada, North American problem. And everybody needs to pay attention before it's too late, because I really think that there's going to be some major lawsuits coming out of this one. And, to Kelly Osbourne and Ryan Seacrest and all the other celebrities, and to all my friends that happen to be using this drug, please do your research. Do your research. Doctors want you on this drug because it's a drug that they can get you on for the rest of your life. Stop it. Stop it. Stop it. Anyways, take care, everybody.